Good morning, this is Michael Massari. I'm one of the PGY2 urology residents at the University of Florida. Today we're going to be doing a day at the VA. Just getting ready, making some coffee. It's about 5:15 in the morning, and then we'll see you over at the VA. All right, here we are walking into the VA. I'm going to go ahead and get our day started. Start by heading over to the office, looking up some of our patients, and then we'll go on rounds. After that, we'll have a morning conference, and then the day really gets going in clinic. All right, we're done with rounding at the VA. Here's the crew.
Morning.
We're heading over to morning conference. Here we are on the wards at the VA. First patient from yesterday, we did a robotic-assisted laparoscopic prostatectomy. We'll see how he's doing. Second patient had some complex stone surgery. Make sure he's okay before he goes home. A lot of clinic procedures today, cystoscopies, biopsies, a lot of walk-ins. As you can see, we use Dragon dictation software over here to help increase the efficiency. We will check back in at the end of the day. It's been a pretty busy one. We'll see how things go. We're back after a marathon clinic. A lot of patients. We did some cystos, we did circumcisions, we did ureteral stent placements. We got a bunch of consults, and luckily the best senior resident, Dr. Archer over here, was able to help us out. Here he is. Dr. Archer is heading off to Tupelo, Mississippi to start private practice in just a few days. Archer, what do you have to say to the prospective UF students about what the VA brings to the resident experience at Gainesville?
To the prospective students, that the VA experience is second to none. You get to spread your wings with some autonomy, learn straightforward procedures as a junior resident, and then hone your skills as the chief coming back. And after you completed all your other challenging Shands rotations, practice those skills on, get better at them.
Well, there you go. That's a wrap at the VA. We're going to finish up some paperwork. We'll take a look at the patients we still have on the inpatient side, and then we'll try to get out of here at a reasonable hour. All right, so we're done at the VA. This is Dr. Maida.
Hey.
This is the rest of the urology team.
Vlogging. We out here vlogging for Dr. Massari.
We made it for Dr. Batra's fellowship acceptance, Indiana. He's going to love it. Pediatric urology.
Oh, yeah.
We just got home, eating dinner, and hanging out with my doggo, who's trying to lick the crumbs off the plate. It's a new day, and I wanted to revisit our vlog to talk about some of the reasons why I chose the University of Florida to train as a urology resident. I think the first reason is the people, whether it be my fellow residents or the staff. I think we're a very social group. We all get along quite well. There's a very collegial atmosphere amongst our entire group. And I think that was the biggest and most obvious attracting point that led me to choose this program. When it comes to our mentorship model, I think that's a very important and relatively unique part of our program. I think that there's an exceptional amount of knowledge that is gained by breaking up our services into multiple subspecialty focused areas of urology. The way that we do this is by breaking up services into oncology services, reconstructive urology, pediatric urology, endourology. And by separating these and having dedicated either 1 month to 4 month spans on these services that are repeated as both a junior resident and a senior resident, it gives you an opportunity to dive deep into particular aspects of urology and particular procedures, and to learn them and to have a graduated responsibility in both the operative and clinic environment, such that by the time that you advance through your years, I think that you gain a greater appreciation for the subspecialties, as well as learn to have, or get an opportunity to have meaningful time with the attending surgeons on the services. I think the mentorship model also offers an excellent opportunity to develop specific mentors within our program who can offer exceptional research opportunities and personal and professional guidance as well. And then there's the VA, where you're able to amass all of the information that you've learned from all of the subspecialty rotations that you do at the main hospital and put them together in an independent way with significantly increased autonomy as effectively a general urologist in practice. And this experience in particular is invaluable. Another thing that sets our program apart is our location. Gainesville, Florida is an exciting place to be, but at the same time is different than what you would get in most larger cities. It's a college town, and it's a smaller town in that regard, but it's ever growing. You have the football games, nature close by, a relatively inexpensive cost of living, and the ability to afford certain luxuries as a resident that you simply wouldn't in larger cities. And I think that that's an important thing to consider when looking for any program. We're here to learn good surgery, and I think that that's what we get here at the University of Florida. Thank you.